again, everybody, welcome to the Age-Friendly Marin Forum. I am Patty Stoliar from Age-Friendly Corte Madera. Today is October 27, 2021. And if you're not familiar with Age-Friendly, you can find a whole description of it at Aging Action Initiative, and I will put that link in the chat as well. What we've done is several leaders from the age-friendly communities in Marin get together and brainstorm ideas for topics that we think will be helpful and interesting for older adults. And if you have any ideas of something that you think would be a good topic, please put that in the forum, because we're always interested in what people want to know about. Today we have Diana Lopez, who is the chair of the Marin County Commission on Aging and a HICAP counselor. And HICAP is the Health Insurance Counseling and Advocacy program, which is so fantastic and free. So she will tell you a little bit about what HICAP is. And then we'll talk at the end about what's upcoming for next month, which is also a very important topic on getting your ducks in a row for your final exit. Okie doke, I will pass it to Diana, and I think she has a presentation that she's going to share with us, and let me know if you have questions. Welcome, Diana.
Thank you, Patty. Thank you, all of you, for being here. The reason I'm here, as you probably know, is because it's the annual enrollment period for Medicare Part D prescription plans and also Medicare Advantage plans. So I'm going to give you the best update that I can about what the landscape looks like, what things you should be thinking about during this period of time. And then I want to leave ample time for questions, because this is, you know, it changes every year. And it's complex, but certainly not complex enough to foil any of us. So I'm going to share a presentation, and we'll get started. So let's see. Okay, here we go. So this is me. I am a HICAP counselor, and we're going to talk about insights into Medicare for 2022. Just a quick overview about what Medicare is. It's national health insurance. It covers pre-existing conditions, and your eligibility to belong to Medicare isn't based on your income. Medicare Part A really focuses on inpatient services. It's funded by payroll taxes, and sometimes you read things about Medicare going broke. Really can't go broke. There's money there. Sometimes there isn't enough money there to cover all the services that are being used, but up until now, Congress has always come forward and covered those costs. Medicare Part B covers outpatient services, and it's funded differently. It's funded by premiums, it's funded by federal and state revenue, and also on interest on its investments. So when you think about Medicare Part A and Part B, they are two pieces of the same puzzle, but they have different funding. So it's important to remember that. It's a huge system, and Medicare influences the entire healthcare system. In 2022, Medicare will be covering 62.6 million people, 8.6 million of whom are under 65. And it covers people of all ages who have end-stage renal disease, ESRD, and ALS, or have been disabled for 24 months. If someone's disabled for 24 months, on the 25th month, they automatically become eligible for Medicare. And Medicare accounts for 20 cents on every dollar that's spent on healthcare, 30 cents of every dollar spent on prescriptions, and 25% of all the hospital spending that's spent 25% of hospital spending throughout the United States. And one, I think, very cool thing that I discovered as I was doing my research is that Medicare also pays for graduate medical education for interns and residents in rural and teaching hospitals. So there are two ways to get your Medicare. You can sign up for original Medicare, which includes Medicare Parts A and Part B. If you're working and you have healthcare coverage through an employer group health plan, you only need to sign up for Medicare Part A. And it's a wise thing to do because if you have some catastrophic thing happen, Medicare Part A can act as additional insurance for you. But typically people, when they're ready for Medicare, sign up for both Medicare Parts A and Part B. And if you're going with original Medicare, you'll purchase a Medicare Part D prescription plan. And we recommend that our clients purchase a Medicare supplemental insurance plan. Because Medicare was never designed to cover 100% of your healthcare costs, the Medicare supplemental insurance policy, which is an insurance product, will cover the other 20%. The other way to get your Medicare is to join a Medicare Advantage plan. And what happens with a Medicare Advantage plan is that you assign your Medicare Parts A and Part B to whatever plan you join. A Kaiser or United Healthcare's Secure Advantage. I'm forgetting the name of the plan. Anyway, you assign your Medicare Parts A and Part B to the plan you sign up for. And typically Medicare Advantage plans are either a health maintenance organization plan, or we're seeing more preferred provider organizations and Medicare Advantage plans. And typically Medicare Advantage plans include the prescription plan. So you don't have to purchase a separate prescription plan, and you do not need, nor can you purchase a Medicare supplemental insurance policy if you decide to join a Medicare Advantage plan.
Diana, can you explain the difference in HMO and PPO?
Yes, a health maintenance organization has its own network of clinics, of healthcare providers, both physicians and other folks that provide healthcare. A PPO has a wider network of doctors and clinics that you can go to, and typically the preferred provider organization will cost a little bit more. And also preferred PPOs allow you to go out of the network. You pay more, but you can go out of the network. So that's a little bit of the difference. There are a number of differences between health maintenance organizations and preferred provider organizations, but that'll get us started with that. Medicare 2022. So everyone wants to know how much they're going to be paying in 2022. And unfortunately, I can't give you that information because we don't have it yet. We won't have it until November. So for Medicare Part A, I put in the information for 2021. The monthly premiums, if you have worked 40 quarters or 10 years, typically you have no premium for Medicare Part A. But if you worked between 30 and 39 quarters, you'd be paying $259 a month in a premium for Medicare Part A. And if you worked less than 30 quarters, $471 a month for Medicare Part A premium. It's not typical, but it's important to let people know who haven't worked, at least not paid into the system. I'm sure they've worked in other capacities, that there is a premium for Medicare Part A. In 2021, there was a $1,484 deductible for Medicare Part A per benefit period. And this is a little bit of a complex thing to explain. A benefit period starts on the day that you're hospitalized. And then it ends 60 days after you are out of the hospital and have not returned to the hospital for anything related to that particular issue. So very rarely someone can have 2 deductibles in a year, but that's what a benefit period is. Daily copays in 2021, in the hospital, 60 days, there's no copay. And if for some reason you need to be in the hospital more than 60 days, it's a $371 copay. And that was in 2021. And then if you need to go to a skilled nursing facility, the first 20 days, there is no copay, but on the 21st day, the copays begin. And in 2021, the copay was $185.50 a day. Now, Medicare Part B, this is what's projected for 2022, and we won't know for sure. Let me turn off my phone, sorry. We won't know for sure until November, but it's looking as if the monthly premium for Medicare Part B in 2022 will increase $10 from $148.50 to $158.50. And the deductible will increase, I believe, trying to, if memory serves, it was $203 this year, and it will increase $14 to $217 next year, and coinsurance stays the same, 20%. So this is all, everything I just said about Medicare Part B is speculative, but that's what we're hearing. So I wanted to share that with you today so that you can have some idea in your mind about how much the monthly premium and the deductible for Medicare Part B will go up in for 2022. So there are some costs beyond what you pay in your premiums and deductibles for Medicare Part B. If you have original Medicare and you don't purchase a Medigap or a supplemental plan, though is 20% that you will have to pay. And then there are some out-of-pocket costs, and as we all know, and is hopefully going to change sometime in the future, Medicare doesn't cover vision services, dental services, or hearing, and definitely does not cover long-term care. And unfortunately, unlike the Veterans Administration, Medicare can't negotiate drug prices. That's another issue that is being worked on federally, but no changes so far that I can share with you this year. I want to go back to slide that I showed you a little bit earlier. The areas that I'm going to be covering today, because it is the annual enrollment period for these, for prescription drug plans and Medicare Advantage plans, these are the two that are highlighted in red are the areas that I'm going to be speaking with you about today. So I'm going to start with Medicare. I think I'm on the right slide. Thank you. Yes, thank you for your patience here. I'm going to start by talking about Medicare Advantage plans. There's more to talk about in terms of prescription drug plans, so I'm going to start with this because it's actually a shorter part of the presentation. There were 26.5 million people enrolled in Medicare Advantage plans in 2021, and that's projected to go up to 29.5 million people in 2022. Medicare Advantage plans will continue to offer a wide range of supplemental visions, supplemental benefits, including vision and the other items that I've listed here on this slide. But I was just reading this morning about an article about whether it's worthwhile to pay additional premium or separate premium for these benefits, and instead of actually getting a separate plan for vision and dental. And typically, it's not necessarily, cost effective. So, but they will continue to offer these. Sorry. Oops, sorry. My presentation has decided to have a mind of its own this morning. So in addition, the percentage of plans offering special supplemental benefits for chronically ill individuals will increase in 2022. The focus of Medicare Advantage plans has changed a little bit to try and broaden the benefits that they provide, particularly in support of people that have chronic illnesses, because with the absolute realization that just having health benefits isn't enough support for people with chronic illnesses. They're really looking at transportation and other kinds of benefits that can really help people with chronic conditions. So in 2022, this is a slide, and I don't know that you can see it so well, but these are the Medicare Advantage plans that are going to be offered in Marin County in 2022. And I'll send a copy of this slide presentation to you, Patty, or who do I send it to so that it can be distributed?
I think it would go to Sarah.
Okay, so I'll send this on to Sarah so that you can see it. You can see that Kaiser, for example, will have 3 different plans, and the basic plan. Well, they've changed the nomenclature. So the plan that we're used to having for Kaiser is now called Enhanced. The monthly premium will go down. It was $89 in 2021, and it's going to go down to $85. They have a basic plan that will be $25, and then they have this third plan is a plan for dual eligible people who both have Medicare and Medi-Cal are eligible to join this plan. And United Healthcare expanded its offerings of plans in 2021, and I think that they are, I wonder if it's still, I'd have to look. Off the top of my head, I think that these are the same 5 plans that they offered in 2021. And as you can see, highlighted in, actually they did this in 2021, but they're continuing to offer their PPO plan in 2022. Western Health has reduced, I believe, the number of health plans has reduced the number of Medicare Advantage plans that they're offering in 2022. Alignment has added Medi plan. Aetna Medicare began offering their plan in Marin County in 2021, and they're continuing to offer their plan. And Align Senior Care is the only new plan for Marin County in 2022. I can't see the, with the slides up, Patty, I can't see the chat. Is there a question that I need to answer now?
No questions in the chat.
Okay, thank you. All right.
I just wanted to point out Align and Alignment are 2 different companies.
That's correct.
That's terrible. Thank you.
Yeah, but that is correct. So beginning in 2021, people with end-stage renal disease could join a Medicare Advantage plan. That will continue in 2022, which is a good benefit. And interestingly, the average Advantage premiums have been declining for the last several years, and 2022 will be no exception to that. As you can see, with the premium for Kaiser, it's only going down $4 a month, but that's still a decline. And also the cost of premiums for the prescription plans that we'll be talking about in a minute are also going down in 2020. And because due to COVID, Telehealth services were expanded in 2020 and 2021, and that will continue. Telehealth services seem to be more and more folded into all the plans that are being offered. So I think that's a good thing. And last year, the out-of-pocket maximum increased to $7,550, and that will continue in 2022. So that's a bit of an overview of Medicare Advantage plans and what they're going to look like in 2022. And now I'm going to move to Medicare Part D prescription plans for 2022. Last year in 2021, there were 32 plans, and those have there's going to be a smaller number in 2022, and many of you may have already heard from the plan that you were in, your prescription drug plan, which is part of original Medicare, that the particular plan that you were in 2021 is no longer going to be available, and the company that you've been with is offering you for you to be in another one of their plans. So this makes it really vital this year for you to look at the plans. If you have a prescription drug plan and you've received that kind of information and they've let you know that it's going to be more expensive, to get a hold of HICAP or to do a search yourself. And I'll talk about that a little bit later in the presentation. So from 32 plans to 25 plans, still the same companies, but companies that were offering plans have sort of reduced the number of plans that they are going to offer for 2022. The monthly premiums in 2022 are going to range from $7, almost $8 to $107. The deductibles from $0 to $480. And the formularies for your prescription drug plan will change every year. Some prescriptions will move into lower tiers, which means they cost less. Some medications will be added to formularies in different tiers, so it's important to take a look at that. And copays and coinsurance vary by plan and tier. And one of the keys to determining which is the best prescription drug plan for you is to really look and at the preferred pharmacies, because all the plans negotiate with the pharmacy chains, Walgreens, CVS, etc. And so a copay at one pharmacy may be a lot less at another pharmacy that is a preferred pharmacy. So these are all factors that you need to look at as you're looking at your prescription drug plan for 2022. Excuse me. So which one is the right Part D plan for you? Really depends on the medications that you're taking. Every medication has a different price in each prescription plan. Each plan has a different formulary, and each plan negotiates different copays with each pharmacy. So, and it changes every year. So it is vital that you take a look at this every year. How can you lower your prescription costs? By doing an annual search of your Medicare Part D plan, switching to generic drugs. Sometimes, but not always, it will cost you less if you get your prescriptions through mail order pharmacy, but that's not always true. Some prescription drug discount cards are very good, and they're online discount programs. And say, for instance, during the year, it turns out that you are prescribed a very expensive medication. What we do at HICAP is we help clients find a way to pay for those medications and get help paying for those medications through the pharmaceutical assistance programs. So always, if that happens to you, get a hold of us, because we can help you find ways to pay for that expensive medication. And then if you or your spouse is a veteran, then the Veterans Administration has its own prescription drug plan, and often that often costs less than the usual Medicare Part D prescription plans. And then if you are eligible financially for Medicare, Medicare will if you're eligible financially for Medi-Cal, Medi-Cal will automatically send that information to the Social Security Administration to see if you are eligible for a low-income subsidy, their low-income subsidy program called Extra Help. So there's help out there. So don't despair if for some reason, and let us know, and don't despair if during the year you are prescribed an expensive medication. HICAP can help you find ways to pay for that medication. Very important point in this presentation, because you'll want to take the medication and have it. So what we're doing now in the annual enrollment period is doing Medicare plan searches. You can do your own. You can go to Medicare.gov. You can go to Medicare's website at medicare.gov. You can find and compare all the plans in your area. Your current plan will be in there, and you can even enroll in a plan online. If you would like HICAP to help you with that, which we're more than willing to do, please go to the Senior Advocacy Services North Bay website, which is right there, www.senioradvocacyservicesnorthbay.org/HICAP. And you can document your medications, what the dosage, the dosage is, what the frequency is, and we're happy to complete a search for you. If you don't have a computer, or hopefully you can find someone that does have a computer, and you can download that form and fill it out by hand and mail it to HICAP, and the address for HICAP will be on the last slide. And what we will do is, if you do it online, we will send you customized search results reflecting the least expensive prescription plans for you for 2022. If you ask us to, we'll include your current plan. And if you don't have a computer, you can mail it to HICAP, and we will mail you the results of that search. A little bit about the Low Income Assistance Program. Social Security Administration administers it. Countable monthly income is below 150% of the poverty level. And so I don't know whether those amounts will change for 2022, but I wanted to at least give you this just in case you are eligible, because it gives you a lot of help for your prescriptions. And you can apply for extra help by going to the Social Security Administration website at ssa.gov, or you can apply on the phone, and here's the number for that, or by contacting HICAP, and we can help you with that. So Medicare is always trying to be innovative and change things. There are, in addition to Medi-Cal, if you're eligible for Medi-Cal, you will be automatically eligible for extra help. There are other Medicare savings programs that, if your income is higher than what it is for Medi-Cal, there are other Medicare savings programs that you can apply for. And you do that through Health and Human Services, the same number that you would call to apply for Medi-Cal. If you're not eligible for Medi-Cal, they will automatically help look and see if you're eligible for any of the other Medicare savings programs. But what is happening is that in California, about 30% of Medicare beneficiaries have incomes at or below 200% of the poverty level, and they don't know about the Medicare savings programs. So it's important to let people know. Millions of people, I think 2.5 million people in California, are eligible but not enrolled in the programs that can help them with the costs. And states actually are able to set higher income and asset limits. Medicare and Medicaid actually are working to simplify the eligibility criteria and the enrollment processes for these Medicare savings programs. A little bit about the HICAP, the Medicare Health Insurance and Counseling and Advocacy Program. We do what I'm doing today, educating you about Medicare for 2022. And we work with people who have or are about to become eligible for Medicare. HICAP, I'm very proud to say, began in California in 1986. It's funded by the Older Americans Act and administered by the Federal Administration for Community Living and managed by the California Department of Aging. So a lot of pieces to HICAP. We are a volunteer-supported program. I'm a volunteer. The main office for the North Bay is up in Petaluma. There is a small staff there, but most of us are retired or semi-retired professionals who go through training, extensive training to become a HICAP volunteer. And we are registered by the state of California and provide counseling about Medicare benefits and rights, supplemental plans, retiree plans, a bit about Veterans Administration health benefits, obviously Medicare Advantage plans, because I talked to you a lot about that this morning, prescription drug plans, the low-income assistance programs, and there are 2 people in the office who have expertise on long-term care insurance, which is an issue that is come to the fore lately because people are not being able to afford the care that they need that is beyond what Medicare provides. So this is my last slide. This has all the information that you need regarding the HICAP program here in Marin and 5 other counties in the North Bay, phone and fax and address in case you are filling out the form for your to do a prescription drug search for 2022. This is the address that you will need to send it to, and we'll get it back to you as quickly as we can. And I want to thank you all for being here, and I want to leave a lot of time for questions and discussion. So I'm going to stop sharing the presentation.
Wait, I was just going to tell people that they should take a screenshot or take a photo of your contact information. So they're perfect. That way you know how to phone up to Petaluma, how to email, and if you need to mail, there's the mailing address as well.
And also I will put my personal information in the chat as soon as I stop sharing. And so you can contact me directly if that works better for you.
Perfect. Thank you for putting that back up, Diana, and thank you for your information. Okay, so we already have some questions in the chat, and people can continue to put questions in the chat or to just unmute and ask your question. So do you have a private insurance representative that can go over somebody's plan with them?
No, HICAP, we're volunteers, and we insurance reps, if you want to use one, they get paid for their services. What we like to say is that we we're going to give you the whole picture of what's possible for you in terms of Medicare. And insurance reps have a lot of expertise, but they're also being paid for their services. And that's what distinguishes HICAP from insurance reps, is that they actually, I'm going to put myself on gallery view so I don't have to look at myself, which is disconcerting to say the least. It really depends. If you have somebody that you really trust, that's fine. Or if you would like HICAP to help you, we can help you too.
Okay, so they may be biased as well as charging a fee. So I guess that's why the
that's why that was why HICAP was created.
That's what I was going to say. Someone questioned poverty level being 19,000 a month in Marin. Is that?
Yeah, I know. So, so I'm trying to see. So I'll give you. Hang on, just 1 second. I'll give you the number for Health and Human Services in Marin County. Just 1 second.
That was the next question, is how do you contact Health and Human Services to find out about help for people above the poverty line?
Right. So you call in Marin County 1-877 or 10-8817. And they can help you. I work closely with Medi-Cal, which of course is Medicaid, and they'll help you. They've had to change their procedures like the rest of us due to COVID-19, but they will help you determine whether you're eligible for Medi-Cal, and if you're not, talk to you about the other programs. They're called QIMBY and SLIMBY. They have all these different acronyms. We live in a world of acronyms, but some of these programs can help you pay for the Medicare Part B premium. They're very, very helpful for people that have a low income but don't meet the requirements for full Medi-Cal. So yes, please call them and they will be happy to help you.
Perfect. Those are the questions that had been posted. So does anybody have a question for Diana, or some confusion about Medicare Advantage versus Medicare Part A versus Part B, how the Part D fits into the program? Anybody want some clarification?
I do. I'm Claire, and
Claire, you should get some clarification.
Exactly. That's why I'm here. I have United Healthcare. I've had it for a while, and I have the regular plan because to get the what is the other plan? The Advantage plan, you can't get weekly therapy. You can get like psychotherapy weekly with the United Healthcare regular plan, but not on the Advantage plan. That's my understanding of it. Is that your understanding?
We don't really delve into the specifics of the plan. What you're saying, Claire, is that you have you have original Medicare. Is that correct?
Correct. Plus a United Healthcare supplemental.
Supplemental plan, and it's only the plan that I would call wow, why am I blocking on this? I'm sorry.
Well, this is why I have. It sounds like it's cheaper and to my advantage to be on the Advantage plan. But if I go on the Advantage plan, I will miss out on free weekly therapy that is Medicare approved therapy, though it's harder and harder to get Medicare, therapists in Marin County who will take Medicare.
Well,
So,
and that's true. That is true. In Marin County, there are a number of, there are many physicians that do take Medicare, but because it's a wealthy county, there are many physicians that don't contract with Medicare. So you're absolutely right about that. But what I would do, Claire, is I would call the Medicare Advantage plan Secure Horizons, that's the name of it, because they change their benefits all the time and they've been required to expand their mental health benefits. So,
really, huh?
So it's worth a call.
Okay, great. Thank you.
Thank you.
Anybody else curious? I'm gonna pick Diana's brain. Wendy.
Yeah, good morning, everyone. I have a question, Diana. I generally see patients who have Medi-Cal only, but then oftentimes once they've been disabled and getting other benefits, SDI for a couple of years, or if they become age for Medicare, they get letters to join Medicare. And in the past, I've counseled them not to, and because it hasn't been required, because it's too confusing for many of the clients that I visit, and Medi-Cal just kind of covers 100%. Do you know, is there ever, or is there already a requirement to join Medicare if you are eligible?
Well, so Wendy, I advise people actually to use their Medicare. And because once you're eligible for Medicare, Medi-Cal won't pay for your prescriptions any longer. So I work with a lot of people that are under 65 that are receiving and have become eligible for Medicare due to a disability so that they can get the most out of their Medicare. And one of the other issues, Wendy, with people that are getting Medicare because they're disabled is that it's very difficult for them to get a supplemental plan. It's very expensive. And so it may be wise for folks in that situation to consider joining a Medicare Advantage plan, which will then, they can use their Medicare Part A and Part B. It includes a prescription plan and they don't need a supplemental plan. So often for those folks, it is a Medicare Advantage plan is a wise place for them to be to get their health care. And then when they turn 65, everything starts all over again, and they have this window of 3 months before they turn 65, the month they turn 65, and 3 months after to reset everything and make a decision about whether they want to continue in a Medicare Advantage plan or whether they want to go with original Medicare. It's always wise for them to use their Medicare, Wendy.
That's so, I have a follow-up question. That's so interesting. I've never had an issue with their medications not continuing to be covered. It could just be that the physicians then do a TAR, a treatment, whatever that special prescription process is. But that's good to know. I'll look into it more. Thank you.
Yep.
Anybody else? Questions?
I think this is complicated enough. There should be lots of questions. Claire.
Claire.
I have another question. My understanding is because I'm on United Healthcare, I automatically would go with the Walgreens medication plan that they have. Because that is the one that they United Healthcare negotiates with. Should I be exploring other medication plans?
Yes, your supplemental plan is completely different from your Part D plan.
Really?
And every year you should take a look at that and see, which prescription plan will be the best one for you in 2020. And it may not be a plan that United Healthcare is offering, a prescription plan.
But I could still go for that plan even though United Healthcare isn't offering it?
I'm not sure. I'm not sure what I don't understand your question.
I thought that the medication plan was linked to United Healthcare, that if I got—
No, your supplemental plan and your prescription plan are completely different.
Are completely different, huh? Well, I've tried to look, on the computer to find my medications for next year, but it's really confusing. So I'm really happy to find out that HICAP will help me do that.
Yeah, and I'm just putting, I'm sorry, I can't walk and chew gum at the same time, but I'm putting my name and phone number.
Because I don't take many medications, but the things that I did take were hugely expensive this last year. You know, the medications I did have.
Yeah, so happy to help. Sorry, yeah, let me get this in, make sure it's correct. All right, here you go, everybody. This is me, and feel free to call me or email me.
Thank you so much.
Happy to help.
Yes, that's something that I go through every year because I put my medications into the website, and then it comes up with, oh, here's the cheapest with the least out of pocket for your annual year. And it has nothing to do with which my supplemental is. It's completely unrelated to the supplemental. And I appreciate that you can go through that every year, but it is challenging until you get the hang of it. So that's why I loved going to HICAP originally. Okay, and then there's a question, what happens to people in long-term care who run out of money? Does each part have its own out-of-pocket maximum?
Okay, so that's a good question. So let me start with long-term care. Some people, you know, started paying premiums for long-term care policies in their 50s. And what's happened is that the companies that offer those policies, I guess they didn't expect us to live so long. They've become increasingly expensive, and they're really, you know, there's a lot of focus. The state of California is focusing on long-term care, money for long-term care to cover long-term care costs, but so far it really hasn't gone very far, and it would only be for people who could, you know, start to invest in their 50s. So long-term care insurance right now is quite problematic. And what people do when they don't have money for long-term care is that they apply for Medi-Cal. And what has been in the past, you had to spend down your assets to $2,000, but that's changed. As of July 2021, an individual can have $130,000 in assets to qualify for Medi-Cal, and if you have a spouse, you can add $65,000 to that so that you can keep some money to pay for your long-term care. Before it was just, it wasn't possible, because what can you do with $2,000? So that's changed, and that's part of the California, that was part of the California master plan. So familiarize yourself with the California master plan, because it's making a lot of changes and making things more realistic and a bit easier for people who are, all of us who are aging.
Wow, I had no idea about that change. That's significant. Because, yeah, I was under the impression that you had to spend down all of your money before you could get Medi-Cal. So
yeah, absolutely.
Spread the word to all of your friends and relatives.
Please, there's a question from Mary Ann that she has someone who set up her health plan years ago. Mary Ann, do you have original Medicare or a Medicare Advantage plan?
Wait a minute, I got it. Oh, there I am. I have, I don't know, I have A and B, and then I have a drug plan with Aetna and an Anthem copay card also.
Okay, so yes, so you have original Medicare. And yes, you should be checking every year because, for example, I worked with a a lovely woman at the Redwoods in Mill Valley, and we were able to save her, just on her prescription plan, $5,000 a year.
Wow. Is this, I don't know why I have this man, and he keeps contacting me. Is he like an agent like you are, and he gets some kind
I'm not an insurance agent.
No.
I'm a volunteer. And so what I'm guessing that he is an insurance agent, but I have no idea.
I don't either. Okay.
Yeah. So definitely call him and find out what's going on, because you might be able to save a substantial amount of money. And Sandra wrote, under assets, does that include the house? It does not include your house or a vehicle. And there are a few other things it does not include.
Okay, would he be making money off of me when I call him, or should I go to?
If he's an insurance agent, yes, he will.
And that'll add on. Where do I see that? Then I've never
It
seen.
doesn't. You won't be paying it. The insurance company pays him.
Oh, okay. So it's not going to change my costs, and he knows all my plans. So I'd be better to stay with him. Okay, thank you.
But make sure that he does a prescription drug plan search for you, because if he's not doing that, then you're not getting the best. It may not be the best option for you for your prescription plan. Sometimes we do plan searches and the same plan comes up and it is the best option, and then people just continue with that. But often it is not the best option.
You can tell him that you attended this presentation and you were told that every year your plans should be reevaluated, and you want to make sure he's doing that for you every year.
Right, because I had one drug that ended up as a class 3 or something, pretty pricey, an inhaler. And now I have a doctor that prescribed Lyrica, and that turns out to be another stage 3. So I'm worried about how much money I'm laying out for these.
Right, and you may not have to spend that much money, and the medications are in tiers, right? I talked a little bit about that, and sometimes as patents expire, a tier 3 medication will move into a tier 1 or 2, which makes it less expensive. But new medications can be tier 3, tier 4, or even tier 5, and they're extremely expensive. And if you have expensive medications, please call us, because we, you don't have to buy your medications through the plan that you have. There may be other options for you that are less expensive. Shama, you have your hand up.
Yes, I do. I have typically not changed my prescription plan. Part of it is foolishness, but now I'm wondering, part of it was that I worried about having to change my pharmacies every time I changed my plan. Is that?
Well, what you want to do is you really want to do a prescription drug search every year to see the costs. And what the search also will tell you is which are the preferred pharmacies, and you really want to go to that pharmacy because the co-pays can be wildly different. And if your goal is to optimize the prescriptions that you're getting at the lowest cost, it's an exercise that you really need to do, or have a HICAP counselor like myself do for you and with you, so that you can you pay the least that you can for your prescriptions. I don't think that the pharmaceutical companies need us to pay extra.
Okay, thank you. For more than one reason, I'm glad I attended this meeting.
Shama, I wanted to say that ever since I started on Medicare, I have used the mail delivery because it was a cheaper option than going to the pharmacy. And for me, it's much easier that it just goes into my mailbox. And so I much appreciate having the mail order option to save money and to be more convenient. So a lot of people skip that and just look at what drugstore it is, but consider that. And we have a couple questions in
Yeah,
the chat.
so Patty, before we go to the next questions, is that when we do a prescription plan search, we always include the mail order option for people in case they want to do that. And then I just want to emphasize that sometimes mail order is not less expensive. So often it is, but sometimes it's not.
Thank you.
Are things prorated the year you turn 65?
I'm not sure what you mean by that question.
Lori, do you want to elaborate on that?
Yeah, I'm wondering if I turn 65 in July and there's out-of-pocket maximums for the year, I would assume that that's not going to be the same since I didn't turn 65 in the beginning of the year.
Well, yeah, things are prorated. I see what you're talking about. Yes.
And no insurance company will let you stay on their plan after you're 65. Is that correct? Like Blue Shield and the regular.
Well, no, I mean, Blue Cross Blue Shield may have an offering for you, that is a Medicare plan. But what happens is that if you have original Medicare, you're responsible for finding your own doctors and doing all that and purchasing a Medicare Part D prescription plan and a supplemental plan. So there are 4 components to original Medicare. If you decide to join a Medicare Advantage plan, Medicare Advantage plans, I'd say over 90% of them include a prescription plan, and the cost of that is included in the premium for the Medicare Advantage plan, and you don't need a supplemental plan because all the benefits of supplemental plans are included in the premium for a Medicare Advantage plan.
Do you have a Medicare Advantage plan?
I do.
It sounds, I always wonder about the words because you never know if Advantage is really an advantage.
That's what they're called. And so I don't have another name to call them. I mean, they're managed plans. They're either HMOs or PPOs. And Medicare is going to more kind of, and they're regional, right? So although say if you sign up with a Medicare Advantage plan, say an Aetna one, and Aetna has a plan in wherever you're going, if you're going to Wyoming or Delaware, you can use your plan there. Some plans are more regional, right? Kaiser doesn't have plans all over the country. So that constrains you. But if you have a Medicare Advantage plan and it's a plan that's offered throughout the United States, you can use that plan everywhere. And any Medicare Advantage plan offers you care for urgent care or for emergency care. So that goes without saying. If you decide to, original Medicare is a great option for some people. A Medicare Advantage plans are a good option for other people because you have everything under one umbrella and you don't have to have a Part D policy and a supplemental policy. I am absolutely not here to sell you anything. I'm trying to give you the lay of the land. You're muted, Lori.
This is why I love HICAP. You guys are fabulous. I realize you're not like the guy who calls me on the phone wanting my service or whatever, or my it's amazing. It's like the best thing going that I know of right now in California or in Marin.
Well,
Are you just Marin County?
Yes, I live in Marin County, and
it's great.
Yeah, since COVID though, we've been working with people since we're doing phone counseling rather than in-person counseling, which I miss terribly. I like seeing all of you, but I would much rather be in the same room with you. We've been doing counseling for all the 6 North Bay counties.
I love it. It's the best thing I've found in so long, and I'm like not 65 yet, but I'm worried.
So let's see. So
can you explain?
Yes, I can.
How the price levels work on Part D? What about?
Yeah,
the
so up to about $3,500 in cost, both for the plan and for you and your copays. You pay a certain premium, a certain copay. Then you pay a percentage of the amount of the cost of your prescriptions. And then after you get to, I think it's somewhere in the $7,000 range, then you go into catastrophic coverage where you're paying virtually nothing for your prescriptions. So while the donut hole officially doesn't exist, it changes. There's the first level, which is about up to 3,500, and then the second level, which is up to about 7,500, where you pay not a copay, but you pay co-insurance, a percentage, and then after that, you pay virtually nothing for your prescriptions. And there's no out-of-pocket maximum. I'm sorry, pocket maximum for Part D, although there is a deductible, and some people who are taking some pretty basic medications don't even meet their deductible every year, so in order for the plan to pay.
I wanted to make a comment about the accruing medications for your go bag. And I found out that a friend of mine does a brilliant thing, and that is, it's probably out of laziness rather than preparedness, but he fills up 2 weeks of Sunday through Monday little holders, so that at any time, if you needed to go and it was the end of your week, you'd still have another week filled up in your pill carrier. So I thought that was brilliant, that you've always got at least a week that you can grab to take with you. And if it falls on the right day and the disaster's at the beginning of your pill carrier, you've got 2 weeks. So that was what I had seen as a
You can also
workaround.
fill your prescriptions in 26 days. You don't have to wait for 30 days. That's how I've built up my arsenal, is little by little.
Yeah, you can do that, and also talk to your physician and say, expand the number of tablets or pills. I need to build this up, and because you have to renew your prescription every 6 months anyway.
Or ask for samples.
Yep, lots of different ways to do that, and still get your medications through mail order and save those dollars.
Well, except on mail order, I think they only send it to you once a month. I don't think they do the 26 days.
Well, I get mine for 90 days.
Yeah, but I think Sandra's saying that, you get a 90-day supply through mail order. But it's something that if you're concerned about making sure you have enough medication for your emergency, additional medication, that's something you need to discuss with your physician.
Any other questions?
We have a little time left.
Good questions, everybody.
I'm happy to stay and talk. What?
This was really excellent, and you have a good speaking voice. I understood every word.
She is so helpful, so helpful. Anybody else? Any other questions that you're gonna smack your palm against your forehead in about an hour and say, why didn't I ask that?
Jody has her hand up. Hi, Jody. Good morning.
This was such a good presentation, and I was disappointed that there weren't more people here. Is it going to be available on the Marin Village site so that other people can look at it when they wake up to the importance of it?
It's not on the Marin Village site, but anybody can write to agefriendlycortamadera@gmail.com and request a copy of the link to the video.
And you
And
can
it's
always be-
also on Marin local channel on the TV, but we don't know when it's broadcast.
So Jody, you have a question?
No, that was a clapping,
Oh,
not a hand raising. And again, it's
Thank you.
because, you know, as a social worker at the Redwoods for many years, Diana, you and other HICAP counselors were always available. It's just such an unbelievably wonderful program. And I really encourage people who have any questions about your Medicare to follow up if need be, because it's a phenomenal resource. Thank you so much, Diana.
Thank you, Jody. And when I could find the room that I was going to work in at the Redwoods, it was great.
I'm so surprised that people have not heard about HICAP that are going on to Medicare. And I say, number one thing you need to do is get help from HICAP.
Yeah.
I see another question in the chat. Who decides the plan year? Is it when you turn 65 and start? Is it always January 1st to December 31st?
Who decides the plan year? When you turn 65, no. You have 3 months before you turn 65, and the month you turn 65, and 3 months afterwards, actually, but who wants to do that? Because then you might be without coverage. So your coverage will start, so say your birthday is in August 25th, and you signed up in July, your coverage for Medicare will start August 1st. So you have an extra 25 days of Medicare coverage when you turn 65. But do it in a timely way, because that's the sweet spot for everything. If you go with original Medicare and you decide to get a supplemental policy, there's no underwriting, but give us a call. And in the background, that was my daughter reminding me I have to go pick up my grandchildren. So.
And also there's a difference in the year for the supplemental plan and the year for the Medicare. And
that's a really important point. And I didn't really talk about supplemental plans very much today because your open enrollment for a supplemental plan is the day of your birthday. And if you're born today, October 27th, today and 60 days from now, you can change your supplemental plan. You can change companies. You can, if you have, say, a plan G, you can go down in coverage. You can't go up, but G is the G right now because F is no longer kind of in place for people who are just coming on to Medicare. You can go down in coverage if you want to, but your birthday and 60 days thereafter for taking a look at your supplemental, your Medigap plan, and making any changes that you need to make for the following year.
Thank you so much. This was excellent. And